When we are listening in an academic environment, there are a whole new set of challenges compared to the listening we do in everyday life. We are often listening to one person speaking for a long period of time, and it can be difficult to interrupt that person and ask questions if you don't understand or fall behind. The topics of academic lectures can be technical, difficult, and unfamiliar to us. And on top of all of that, we may be trying to take notes. In this module, we are going to consider how we can improve our academic listening skills through making sure we are always able to get the gist or the central idea or theme of a lecture, whether in a face-to-face classroom or an online lecture. Of course, understanding the gist of a lecture will be much easier if we have completed the pre-listening strategies as we talked about in Module 1. Each strategy we learn during this entire course will help us improve our academic listening skills and build on top of the previous ones. You've probably heard this phrase, get the gist of something, before. What does it actually mean? What is the gist, and why is it even important? The gist of a lecture or a conversation or a news report is sometimes referred to as the big picture. It means the central point or key idea when you're listening. If you understand the gist of something, you understand the communication goal of the speaker. Are they trying to inform you or advise you or persuade you? You may not understand all the details, but you understand their central purpose and point. You understand the gist of a lecture or a talk if you can answer questions like, what was the lecture mainly about? Or, what was the topic of the lecture? Or, what was the purpose of the lecture? Remember this talk, Breast Cancer, Are You Genetically at Risk? We listened to this talk in Module 1. It's important to remember the gist of the lecture can be more than one thing. For example, it could be in 2 parts. When we listened to this lecture, what was the gist of this lecture? Here's a clue. It was in 2 parts. In this lecture, the speaker explained the different genetic risk factors for breast cancer and how those risk factors could impact detection. For example, if you were genetically highly at risk for breast cancer, then you would have a different detection approach than if you were a member of the normal population. And that kind of brings us to the tricky part of the gist. How much detail do you need in order to describe the gist? If we think back to that talk, it would not be specific enough to say the gist of the lecture was breast cancer. That really wouldn't tell us enough about what the talk was. Remember, it was about genetic risk and how risk affects detection approach. On the other hand, too much detail, for example, if you said the lecture examines family history, genetic markers such as BRCA1 and BRCA2, and differentiated early detection plans, each in 4 stages, that's too much detail to be the main idea. The more talks and lectures that you listen to in English, the better you'll get at being able to summarize the gist. But why is getting the gist so important? If you can understand the gist of a lecture early on, it actually makes hearing the details and the examples and more complex explanations of the relationships between things much easier. So if you understand that the lecture will be about the genetic risks of breast cancer and the impact that those risks has on detection, then that makes it much easier as you're listening for your brain to try to kind of categorize the information. Oh, this is another genetic risk factor. Oh, this is the impact of that risk factor. This is a second impact of that risk factor, and so on. Okay, here's an example of why understanding the gist is so important. Please read this excerpt from a lecture. What medical situation are these instructions being given for? Really difficult to tell. Here's the title of the lecture. Choking. First aid basics can save a life. Okay, now those instructions make more sense. Now that's a very simple example, but it does show you that from the title, if you're able to read a title and get the gist of what's coming, everything after that makes a lot more sense, and you don't have to rack your brains trying to think about, wait, what are we talking about here? Another reason why getting the gist is so important is it helps a lot if you lose track during a lecture. Losing track, not being able to follow what's happening, starting to daydream maybe, or zone out, sometimes we call that. It happens to everyone from time to time. Listening for long periods of time is very demanding. But if you have already established the gist of the lecture, it's much easier to pick things up again. Okay, we're going to look at the introduction to a lecture about skin structure. Understanding the nature of skin helps in caring for it. I'm going to read this time, so read along. The expression, beauty is skin deep, is well known. But as we get older, we also begin to understand that character succeeds physical beauty in importance. Nevertheless, it is still essential for health that we continue to care for our skin. Internal factors. Also, internal factors that affect your skin can be more difficult to control. Wait, what? Can be more difficult to control? More difficult than what? Also? Uh-oh, looks like I missed something. Something is missing there. Perhaps we've lost the focus or our focus or misunderstood a section of the introduction. But this lecture is about skin structure and the factors which affect skin health. Okay, so we should be able to pick up again here and take notes on the internal factors. I must have missed something, perhaps it was external factors, not sure, but I know that this is one set of factors, so I'm going to keep going. So we now know that getting the gist is really important, and we know that there's a certain amount of detail that we need to have the gist, but not too much detail. But how do we actually recognize the gist in a lecture? I sometimes think that's missing from our understanding of how to get the central idea. So I'm going to give you some strategies for understanding the gist. And you'll use different strategies depending on which ones you find easiest. And also depends on the talk. Sometimes different strategies work for different talks. So the first main way to get the gist is to listen for keywords and main ideas. These are important in getting the gist of anything. But there are phrases at the start of a lecture in particular that can help you identify the gist early on. So for example, today we are going to talk about, here comes the gist. The lecture from this unit is on, today we'll discuss. Keywords and phrases are often repeated. Even for people who are native speakers of English, they need some messaging about what the gist is going to be. Okay, let's practice. We're going to look on the next slide at an excerpt from a lecture on pain relief. The words pain and relief are mentioned many times. In addition, examples of pain and examples of relief are also included. Take a moment and read the introduction. Now I'm going to read the introduction. Listen carefully. Pain Relief, your guide to over-the-counter med products. The lecture today will focus on pain relief and getting a better understanding of over-the-counter drugs. Unfortunately, for most of us, pain can be a fact of life, whether it is a headache, muscle ache, strain, or arthritis. There is relief available. That's where over-the-counter pain relievers come in. Before you make a selection, however, you should be well informed. Did you notice that the keywords were stressed by the speaker? Keywords, which are often nouns or adjectives, are usually stressed more than other words. We're going to listen to that introduction again. Which words am I stressing? Why not make a note of them? After you've made the list, what do you notice? Okay, I'll read it again. Pain relief, your guide to over-the-counter products. The lecture today will focus on pain relief and getting a better understanding of over-the-counter drugs. Unfortunately, for most of us, pain can be a fact of life, whether it is a headache, muscle ache, strains, or arthritis. There is relief available. That's where over-the-counter pain relievers come in. But before you make a selection, you should be well informed. So here are the words highlighted that I stressed when I was speaking. Did you hear that? Do my list of highlighted words match your list of words you noted? You can see how many times the words pain and relief were mentioned in the introduction. And that's very intentional. That's not an accident. That's so that the speaker can establish for you right away what the main idea of the talk is going to be, the gist. Another way that you can recognize the gist is lecture organization. You can understand the gist more effectively if you can understand how a lecture is organized. Remember, there's a lot of information in a lecture, a lot more than a regular conversation. So trying to pick up very quickly the organization pattern of the lecture can help you figure out the gist and the relationship between different parts. Remember when we talked about skin? So let's look at an example of lecture organization. Here's the title of that talk, Skin Structure, Understanding the Nature of Skin Helps in Caring for It. And the organization is in 3 parts. There'll be an introduction, there'll be something about external factors, and then internal factors. Just from seeing this organizational structure, probably if I ask, write 1 sentence about the gist of the lecture, you'll probably be able to do it before you even start to listen. What's going to be compared in this lecture? That's right. The lecture is about how to care for skin and how external and internal factors have different and similar effects on the skin. All that before you even listen. Okay, we're going to listen to that talk about skincare now. Before we begin, let's put our pre-listening strategies into action. Ask yourself questions about the topic of the listening. Have you ever experienced problems with your skin? Are skin complaints a common issue for your patients and clients? Did you notice that your skin changed when you came to live in Alberta? It's very dry here. And has your skin changed over time? Before we listen, it's a good idea to practice the new vocabulary which you might hear in the talk. Complete the Quizlet practice activity and then listen to the lecture. After the lecture, you will complete an activity to check if you understood.